So my name is Rakesh Kumar Jain. I'm Andrew Werk Cook Professor of Radiation Oncology at Harvard Medical School, and I'm the director of Edwin L. Steele Laboratories for Tumor Biology at the Massachusetts General Hospital. More than 100 years ago, a British physician had written what's widely known now as seed and soil hypothesis. And what this hypothesis means is seed will grow only if the soil is congenial. And so I've been working on the soil for the last 40 years. And what we have shown is that the soil of the tumor, or the microenvironment of the tumor, is highly abnormal. And the abnormalities in the tumor microenvironment fuel not only tumor growth, but also confer resistance to almost every form of therapy. What is even more important is that we have identified each of these abnormalities, and we have figured out two very broad ways of correcting them. And we have tested these concepts in animals, and we have taken our preclinical findings from bench to bedside. We have actually done 40 plus trials. And our work has led to, in the last 7 years, 7 FDA approvals on combining anti-angiogenic therapy, immune checkpoint blockers. And currently, several hundred trials are testing this, so we're going to see some more. But that's just one example. Another finding from our laboratory, which came out, that showed that the patients who have a benign tumor around the nerves known as NF2 schwannoma, for which these patients lose hearing. And the only thing they get is surgery or radiation, but that makes hearing worse. What we showed was that if you repair the blood vessels of these tumors normalizes the word we coined for it, then the hearing will come back. And indeed, we published a paper with 10 patients in 2009 in New England Journal of Medicine, and where we showed that of the 10 patients who received this, in 6 of them, hearing came back within a week. And some of these patients have been on it for 16 years, and their hearing is stable. And as a result of this it has changed practice. And so I could give you many examples of findings that have gone from bench to bedside. But what has really given me joy is that I have had the good fortune of mentoring more than 220 graduate students and postdocs. And many of them are now leaders in academia, industry, government. And that's really where the real joy comes from, besides translating, making discoveries and helping patients with it. Ludwig community is one of the most collaborative community, to my knowledge. So, and you know what's so remarkable? You'll never see people from so many institutions meet once a week. It never happened before this. This brought in people from not only the Harvard Medical School main campus, but from all teaching hospitals. And we all interact. New collaborations have started. And as a result of that would have not been possible. And graduate students enjoy these too, or postdocs, because they get to interact with graduate students and postdocs from other laboratory, learn new techniques, bring those techniques to their own projects. So I would say the collaboration has been the biggest plus of this. And to my knowledge, I think this is the only center within Harvard that has been able to do that successfully every week after week. The chemistry is just amazing. That's the way to put it.